Autism spectrum disorder, often called ASD, is the name used for a set of behavioral and developmental challenges. Every individual with ASD is unique and has their own combination of characteristics, which makes them fall on a spectrum of severity and associated features. An individual who has ASD will most often have difficulties with communication. They may experience repetitive language, limited or lack of verbal speech, poor nonverbal conversation skills, and more. In addition, they may have troubles interacting with others, have little interest making new friends, or not knowing how to interact socially. Despite all of this, some may manage to have exceptional abilities in visual, music, and academic skills. In order to cope with some of the challenges that individuals with ASD face, music therapy is a type of relief where music is presented in order to address physical, emotional, cognitive, and social needs of the individual. The music intervention is presented by a credentialed professional who provides the treatment through singing, dancing, listening, or even creating music. Some individuals with autism may try to express themselves through humming, shrieks, and other sounds. And so music therapists work with these sounds using vocal music activities. Examples such as songs with simple words or repetitive phrases and even repetitive nonsense syllables can assist the child's language. Meaningful word phrases and songs presented with visual and tactile cues can facilitate this process even further. Music therapy gives the individual the freedom to discover and express themselves. They can make noise, bang instruments, shout, and as a result, experience the pleasure of emotional satisfaction. One study has shown that music therapy helps individuals living with ASD by improving language comprehension, encouraging the desire to communicate, making creative self-expression possible, reducing non-communicative speech, decreasing echolalia, which is an uncontrolled and instant repetition of the words spoken by another, and lastly, teaching social skills. A recent study done this year has shown that among 364 children aged 4 to 7 years, the mean scores on the Autism Diagnostic Observation Schedule, ADOS, and social affect domain has significantly decreased during the study. This makes music therapy an effective method with deep and consistent effects on improving social skills of children with autism. Music therapy begins with an assessment to determine the goals the individual wishes to achieve. Individuals with ASD are typically referred to build social and transitioning skills, to facilitate self-expression, to facilitate communication, to build vocabulary, and to manage self-harming behaviors. To build social skills, most therapy sessions begin with a greeting song. This song encourages turn-taking, eye contact, singing hello, and singing each other's names. To facilitate self-expression and communication, the music therapy intervention of improvising is used. When improvising, there is no right or wrong. The improvised music is often used as speech, and the music therapist and the client may take turns responding to each other either vocally or by using an instrument. Rachel Finnerty, a registered psychotherapist and accredited music therapist, describes an experience she had while working with a 9-year-old boy with predominantly nonverbal ASD. When we first started, it was difficult to complete a full 30-minute session. He displayed exit-seeking behaviors and was jumping from instrument to instrument. I decided to bring in a music therapy intern to manage his attention while I held the space musically on a piano or guitar. As the routine and expectations became established, he began to spend more time with each instrument and music activity. He has now reached a point where he can self-direct and self-regulate during the sessions. He now sings along to all songs. He participates in music improvisations on the piano and the push bells. He does not seek exit from the room, and we have increased the session time to 45 minutes. All in all, music therapists need to tend to the needs of the individual, which is why music therapy techniques are very flexible. Unlike other therapies, music therapy does not depend upon speech. Since some individuals with ASD have difficulties processing speech, but their ability to interpret music is still intact, music therapy may be more effective than the alternatives.